Assuming that you've done a proper screen, then motion is lotion. And what you don't want to do is send them down the other rabbit hole. Hi, everyone. Welcome back to the podcast. Welcome any new listeners, anybody who's heard some of my content in the past. Welcome back. I appreciate every one of your amazing souls and human beings. I appreciate all of you guys. Just a little housekeeping behind the scenes. What's happening in my life? Just enjoying bringing on some new team members onto sports performance. What else do we have going on? My kids are back in sports, which is really exciting to get some. You can see light at the end of this tunnel. So kids are get back in school and in sports. My fitness has been good. If you haven't followed me in the past, I live by a half hour by half hour schedule. Yes, I said half hour by half hour, not hour by hour, half hour by hour. And that's just to give my full attention and everything that I can and really be passionate about everything that I do and give people the time that they need. And in order for me to do that, I have to be rigid with myself. So that is the latest with me. And where did I get that from? At some point, I went on vacation with my family recently, and we were talking about what how to balance out creating this new company and bringing on a little one and um, trying to raise our kids to the best of our abilities, plus make our company successful and give the time and energy that our team members need. And in order for us to do that, we really had to be lock it down and figure out exactly what time we want to allocate. So my half hour by half hour schedule is in the works. So I'm really excited about that. So nonetheless, the podcast. At first, I always like to start with why did I come up with this one? What not to do with acute injuries? All right. Everything is always stirred by things that happen either at sports performance, my life, conversations that we're having. So this one comes fresh off of somebody who just had a fresh neck injury. And acute injuries are very tough to manage if you don't know what to do with them or where to move with them, how to progress them if you've never seen it before. I've got a couple stories for you as we go into this. So uh, I was very fortunate to have the work experience that I've been able to join and doing a residency and working for the United States Olympic Committee and traveling internationally with pro athletes, being part of NFL combine training. There's a lot that you get to see and things that you would never see in a clinic. And learning how to manage them from people who are experts. I mean, just beautiful to watch. And some acute injuries. Let me tell you some stories first. I got to share. All right. So uh, when I was at the USOC, United States Olympic Committee, we used to manage these BMX events. And BMX, and this is not like just road BMX. This is not just tricks BMX. This is like where they jump up in the air. They're coming like 30 miles an hour down this hill, and they're like doing these huge jumps and all this stuff. And there's 8 or 9 people racing, and just by the nature of the sport, there's always going to be somebody who hurts themselves. So I ended up covering some of these things, and yes, I had spine board training. I did the residency. We've gone over it as a team, but when you have this stuff happening, and you hear the trauma and you see them, some of these injuries were called pancaking. Now, I don't know about you, but I don't want to have an injury called a pancake injury. It's literally that. Somebody just hits the ground and just stays flat. They don't even move afterwards. So some of these athletes would just get injured. And the first thing I did was one of the first times I saw an injury, I was like, oh, I got this. I like sprinted to them. I got the spine board, did all these things. And we went as a team. We actually ended up sending them on a helicopter. And I was like, man, I did a great job. And then I got to remember, you got to stay humble as you grow. One of my mentors at the time, Quincy, he explained, you never run to a trauma, especially when there's cameras on you. And I was very confused. I was like, I thought I did a good job. And he goes, what happens in trauma is that, especially with cameras, they're going to go towards the moving part. So if you're that moving part, the camera turns to you and goes towards the injury, and it heightens the awareness of it. And so when you sprint and you take that big rush, it also calls attention to it. So in the world of media, it's about the racers in the race, and if something happens, you don't want to be the highlight. It's all about the other people. And so that sticks to me to this day. And I even tell my team this is in that, if there's things that going on, I don't want you sprinting or running, and unless it's like life or death, we're talking about something else. But in this case, we had a full team. There were 6 of us available, and we were within, walking distance. There's no need to add another layer. Now, and that might be different in, high school sports, and we're talking about different things. But ultimately, what you want to do is make sure that, during these times, stay cool, calm, and collected, right? Like, that's injury management is about you managing somebody's anxiety, someone's trauma. And when you bring that heightened sense, you're sprinting and your heart rate is up, your blood pressure is up. All you're doing is adding that in. You're fueling that scenario. And if they're coming in with fire, they're already, they're scared. You can't do that. And if you've ever seen really good paramedics or firefighters, they're just coming into you. Absolutely, what's going on? And it's very hard to fight, because fight or flight is happening, and on your side too. But one thing I do remember is approach them calm and collected, so you don't increase their anxiety, their awareness. It only makes the scenario harder. Now, that was at the USOC. Recently, we had somebody come in with neck discomfort, and they had some issues. And we get this all the time, where people wake up with a stiff neck, or they're lifting weights, or they're pressing or something, and they kind of do like a chicken head, like forward or backward motion. They start getting, maybe a pinch, maybe some nerve related stuff going down. Somebody came in recently with neck discomfort, true acute pain, like the night before, came in. And I love this stuff. If there's a few things that I love, and it's acute trauma, I live for it. I want it. There's 2 things that I love. One is a wound management. I love wound care. Number 2 is I love acute care management. It's not for everybody. It's about your comfort level with it. And the challenge is you need practice with it. Unfortunately, you want to practice somebody's, life. If it's a spine, if it's a neck, whatever it is, you don't want to practice those things. So you need to be around people who have done this before to do it right or do it efficiently. And so very fortunate to have good mentors along the way with acute care management. So somebody came in with neck discomfort, and CT junction, nothing too complicated, no nerve related symptoms, bilateral hands are good, compression testing, distraction testing, it was just literally localized at the joint, so it can't turn, can't extend. And that's pretty straightforward, pretty simple. It's a 48 to 72 hours to calm that down, pump them full of meds, and you just get general motion. And the hardest thing to do is not stay still. And I asked that person how they feel today, and they said 50% better. And that's huge, because by 72 they should be about 90% better, and then it'll take him 2 weeks to fill that last 10%. So the story, as I was mentioning this, they said, it's interesting because PTs and they said that typically PTs would tell them to, relax and stay away from things, calm down, no need to rush, maybe stay in bed, or don't do too much, don't lift, don't do anything else. And I was very surprised by that. And so I wanted to share this, and I want to share my personal stories with these things, and how it could impact cases for you moving down the line. Maybe you see acute injury management, maybe you're a ATC PT, maybe you're a chiropractor who's had acute care management. Whatever your profile is, it's not about that. It's about your experience and what you are good at and what you want to be good at. So this person came in 50% better, and all we did was some basic things, so I'll share that. And the sauce, the equation is the same. It's just how you approach and manage it. So I'll tell my personal story first, and then I'll give you guys the tips afterwards. So this was around 2013, 2014. I was traveling with a professional tennis player, and for those of you who don't know, I've done a residency in sports physical therapy as a 15-month residency, and then I worked for the United States Olympic Committee as a healthcare provider for 3 years, and worked pro tennis for about a year, and then some NFL compound training for about a year. So, and then started sports performance physical therapy in San Diego, and in 2013, 2014, prior to starting sports performance, I was traveling with a pro tennis player. And the reason why I say my background is because leading up to it, it was like the perfect equation for me to be by myself with somebody and manage their injuries all day, every day for months. And I was in Paris, France, 2013, 2014. And this was my first professional tour with a tennis player. And injuries are injuries. You're just learning how to manage people. So uh, this is my first contract with this individual. In the world of pro sports, you're usually doing stints like contracts, and then if they give you the thumbs up and you pass the test, you get to stay longer. So it's my first stint, my first contract. So I start, working with this individual. I start to learn their body. I learn their personality, what they like, don't like, what they, how's their schedule? How do I fit into that schedule? How do I not change too many things? And so I'm just trying to navigate the relationship. So within a week of meeting this individual, we fly to Lyon, France. We compete in a competition there, and I take a mobile foldable treatment table. So lugging around this treatment table, my back was a little stiff. And I'd never done, it's 30, 40 pounds, and you're carrying this all through airports from, to hotel to hotel to hotel to the car to the taxi to the hotel to the flight. And we're flying maybe every couple days, we're flying to a new location based on progress. So if you win, you stay. If we don't, then we're flying to the next comp. So when you're in Europe, everything's so close. So we lost competition in Lyon, France, and he says, "Hey, we need to go to Paris after this." So we take the table and we get to Paris, France, and we're preparing for the French Open. And to me, the French Open was like a big deal. And it is a massive deal, and I was very honored to do it, and I wanted to do the best job possible. And so because of that, I tried so hard. I wanted to make sure that everything was on time, that the bed, like the table, everything was ready. So about 2 days before the event in Paris, and actually the athlete doesn't know the story. So if he hears this, I'm glad you never knew. I hope you didn't know. So I have we have two practices a day usually. We had like a morning stretch. We had some strength conditioning. We go have lunch, a stretch session, and then we go train and train technical skills. So in between the strength training routine in the morning, he said, "Hey, why don't you go work out? I'll meet you at lunch, and then I'm gonna take a nap, and I'll see you afterwards." That sounds good. So I went to the hotel gym, and I'm like, all right, I can get a good pump in right before. So I get some dumbbells, and I'm about to do like incline chest press. I think they were like 90 pounds, and I'm like, oh, all right, I got this. I've done this before. I'm doing a couple reps, and on one of them, I put them down, and then I pick them back up after my set, and I'm like, all right, second set. So I bring one dumbbell up to my shoulder, and then the other one dumbbell up to the shoulder, and I just feel my SI and my spine just lock. And I have the dumbbells, and I drop them, and I literally could not move my back. I had a little bit of a zing down my SI and down to my glute, but the actual joints themselves just felt stuck, like they weren't moving. There was no lubrication. So the first thing I think about is not even my own safety, is the French Open. I'm like, this guy has to compete in 2 days. This is not about me. It's about them. What am I gonna do? And so I literally stand up, and I can barely like move, and I'm literally a tin man, and I can't flex, I can't extend, I can't rotate. I am rigid. And he texts me and he says, "Hey, I'll meet you for a skill session. Can we do a stretch session right before? Can you bring the table out to the location?" I'm like, "No, don't do that to me." Of course I can. So I literally like walk to the hotel room, grab the bag, pack it up, and it's taking me 2 to 3 times the time to do all this. So I get there, and I have 0 ounce of tolerance, of pain tolerance when it comes to this. It was ridiculous. It was so much. So we're out and we're stretching, and I'm trying not to show him. I didn't even tell him, because I'm on an interview basically, and I try every ounce of energy to not let him know. And I think to this day he never knew, but I was stuck, and I couldn't move, and I had to pack that 30, 40 pound bag, and it's like oddly shaped. You go side to side, you have to move it into cars. It's not picking up. And if you've ever had an injury like this, it's scary. You think that something is severely wrong with you. So we go through that whole scenario, and he basically, without knowing, he forced me to move, and I had to move that bag. And he did compete in the French Open. We got to the preliminary rounds, and we got through everything. And we ended up moving on to the next tournament. And the great part is he competed without any injury, so I did my part. Well, I didn't compete without injuries. I actually was on the injured reserve list during that time, but he never knew, and that was very important to me, because what happens in my life shouldn't impact his as much as possible. And I'm working for him. I'm working with him, and that was my view. And it's always been my view when it comes to my patients and my clients. And so when I did this, it was one of the best life lessons that actually helped me manage people moving forward. And what I realized was that motion is lotion. Motion is literally lotion. And so going back to somebody coming in sports performance yesterday with a neck injury, and that was acute, non-traumatic, like non-contact, no referral symptoms going down the hands, localized to the CT junction, first instinct is to like, whoa, I shouldn't move. And I told this person, you got to move. Like today, right now, it's going to hurt to sleep. You won't be able to sleep. And depending on your comfort with meds, we talked about meds and the possibility and what can help bring you down. But ultimately, you can't stay stagnant. You got to move. And this person did. It was a miserable night. They came in, got some treatment, felt 20% better after treatment. Following day, 36 hours later, we're at 50% improvement. So within 12 to 18 hours, we got treatment, direction, 20% improvement. Within 24 hours of that, so now we're at true 36, almost 48 hours, 50% improvement. And I asked, what was the difference? He's like, just move. It was just moving. And that was my point. I said, I know, like that. I know exactly what it feels like, number one. And number two, you got to move. And it's very counterintuitive. And the first thing I told him was, now think about the other millions of people who don't have this resource. We push this person in the right direction. They're 50% better at 48 hours within a non-contact acute injury management of their neck, but knowing that direction. So I said, think about the millions of people who don't get this help, or the other clinicians, PTs, chiro. I don't care what your profession is. If you've never seen this, you're going to get scared as well. And the worst thing you can do, barring that you've done good screening tests, the worst thing you can do is stay still. Now let's talk about the general public who might go through a similar scenario, but worst case scenario. You ready for this? So now imagine somebody has a neck flare-up, non-contact injury, trauma. What do? First instinct, ER, urgent care. They're going to go get x-rays. They're going to find findings that had nothing to do with it, but maybe related. It's, oh, you've got neck OA. Oh man, you because of this injury, you have neck OA now. No, like that was an incidental finding. You probably had that pre-existing. So they go into the ER, they go into urgent care, and they have that trauma, and they see that, and so now they put them together. So what does that client or that patient do? They're like, well, now it's because I have OA, and that's why I had the trauma. That's why I have all this pain. No, that's an incidental finding that was pre-existing. Then what do? They'll probably put them in a collar. They'll tell them to, don't do anything for 2 weeks. Just take these meds. And then what does that person do? They take time off of work. They sit at home with a hot pack or cold pack on meds. And if they were on a good fitness kick and life is good fitness-wise, they're going to take probably 4 to 6 weeks off. And they're going to go back to the doc. They're going to send them in for therapy, but it needs 2 to 4 weeks of approval. So they don't see the therapist for 6 weeks. Now you have the psychological trauma. Now they've probably gained some weight and they're frustrated. You're like 6-7 weeks out from an injury that you could have got 50% better in 24 hours to 48 hours. Look at the difference. And my point is that you as a clinician, if you're listening to this, you're probably a clinician. And the worst thing we can do, now you have to do a lot of screening. Okay, so that's a different podcast. I would